Real talk, mind, body, and love. I'm Dr. Kelly Frank. I'm a pelvic health physical therapist.
And I'm Dr. Leslie Worth. I'm a licensed marriage and family therapist and a sex therapist.
And we have this awesome little podcast where we get to come together and just talk about things that are on our mind, and hopefully it makes sense to us and it makes sense to you.
Sure.
Yeah.
It's been a while.
It has been a minute.
I know. We've been busy.
It's been busy, but it's been good.
Yes.
It's been really, really good.
So I think today we're going to do some like case study type stuff.
Yeah.
You want to dive into that?
Let's dive into it. Yeah, I think this is important because I think a lot of people might see this podcast or might dive into online or wherever it is to find their answers, and they all kind of have similar start patterns. So this one case study, and these are kind of like an amalgamation of patients. It's really no one specific case. But I do see a lot of women and their partners who are coming in during their fertility journey. And that could look like anything. It could just look like an IVF or IUI, just having those conversations with those providers. And when you go through the fertility journey, it's going to look a little bit different for everybody. But there is going to be a lot of testing. I was telling Leslie earlier, it's like it's not really in your face. It's like in your vagina.
You feel like a science experiment.
It's a little bit science experiment, and I mean they're trying to do some really incredible, really amazing.
Well,
really
it can feel overwhelming
awesome
too. Of just like it's a lot of scientific jargon. You know, it's this. There's a lot of terms and they're thrown at you that you might not know. Even like IVF and IUI. I remember clients coming to me and they're like, I had to look up like what the difference was between those two.
Yeah, and everybody's journey is going to be a little bit different. And so when I end up seeing these patients, sometimes they get referred to me from an actual fertility clinic.
Which is great.
Which is amazing.
Fantastic.
I love that I'm getting more and more referrals versus people just finding me, online or in little chat groups or in their, fertility support groups. But now it's a matter of pain with sex.
Yeah.
Maybe there is pain with these procedures, but that pain is kind of subdued because, one, you're paying a lot of money to have these procedures done. There's a lot on the line for you and this family planning. So you're going to kind of just say yes to everything that happens down here, and there's going to be a really kind of just like almost like a little cover over your whole body of like, I have to do this. I don't care.
It's a disassociation. Like they're
exactly,
gonna
dissociation.
Mm-hmm.
Yeah, you're going to not be present for this because that is the best way to kind of get through all these appointments that are happening one after the other, or
the problem is they bring that into the bedroom too.
Yes.
Right? It's kind of okay to do that in a doctor's office. We can argue if that's good or not, but now they're with their partner and they're trying to balance intimacy with this on demand. I'm ovulating right now. We have to have sex right now.
Yeah. And so I feel like my role is breaking down kind of the anatomy, which is going to provide them with some sort of autonomy. And even if it is something as simple as asking that fertility provider or that nurse or whoever it is, hey, can my partner and I come into the room maybe 5-10 minutes early so I can kind of just get acclimated? Maybe I do some stretches, I do some breathing, we do some manual therapy to kind of just prepare for that appointment. Kind of just decompress. Kind of just going over what their body should experience, and they still do have the power to say no to a provider, or they can say, go slower, or that does hurt, or can we try a different position? So you still have this sense of control and power in otherwise very powerless.
Right. And then my job working with those clients is dealing with the stress, right? Because the fertility doctors are going to tell you, don't be stressed.
Yeah, so easy.
It was so easy, I wish that worked. And how do we still have some type of intimacy with our partner while we're engaging in this, right? Where it's still, like, we talked about scheduling sex before, but like this is to the like millionth degree of scheduling. And sometimes it's more on my men. They feel like they're just being used. They're just like, I have to be ready to go. It's a demand. It's not sexy anymore. Like, my wife is so stressed out, or my female partner is so stressed out that we just have to do this right now. And like, foreplay is out the window. And it's like, it doesn't have to be. We want to bridge both of them. And how do we take the pressure off? Because like you said, they're spending so much money on this that it's high stakes. They want it to work. And they're just gritting down. And then we're talking about, that's a killer when it comes to sex. And if there is some type of pain going on, that's going to make that worse.
Exactly. Yeah. So I think it's so important. And again, this case study is just kind of anybody who's kind of dealing with family planning, fertility.
Sure. It doesn't even have to get to the fertility part. It's just when people are like, we want to start having kids.
Yeah.
Right? Of the pressure of, especially if some women are like, I remember being taught of like, if you sat too close to a guy, you're going to get pregnant, right? You know, it's like, it's so easy. You know, they sneeze in your direction, you better watch out. And now like they might be having problems, right?
Yeah.
And sometimes I'll talk to them, they're like, we try to go to a fertility doctor, but they said, come back in a year. And I'm like, that's only 12 opportunities. Like, you have to remember, ovulation happens on average once a month for a woman. If you're regular, you know, if you're coming off birth control or these things, like, a lot of things could be happening. So, but a year sounds like a long time, but when you break down the numbers, that's maybe 12 chances for a pregnancy to happen.
I honestly genuinely hadn't even thought about it that way. Like, I mean, I should. Obviously, I should have thought about it that way. But I think of it maybe even less, because then you're also like, that's your own, if we're talking about the person with the ovaries, with the ovulation, but then it's a whole other person who has their own body and their own situation.
And some of the guys, they have to, you know, it's like we talk about the female part of fertility stuff a lot and they do, like I said, they're all up in there. But for the guys too, it's like they have to go, masturbate and ejaculate into this cup so we can do a sperm count. You know, it's just like, I've had guys tell me horror stories of like, I went there was a room with some like magazines from 1980s.
Yes. And you're right next to like the waiting room. You're not in
and
like
they're
a
like,
back
they're standing
corner.
outside the hallway.
You're not in a back corner. Like, you are kind of front and centered.
Yes.
And which is also going to kind of take the fun, the sexiness,
So
which probably shouldn't be fun and sexy at the office, obviously. But
if my guys already have performance anxiety, maybe they have erectile dysfunction or whatever, like now they're like having the pressure of doing this, and it's not fun.
No, it's a lot. So I think being able to talk to a professional aside from your physician, you know, definitely like your family can relate to it, I think, in a couple of different ways, but sometimes people don't want to talk about family about it stuff because it's like the fertility. I have some people in my own family that had to go through IVF and all that stuff, and it's like you don't want to talk about it a lot because it's such a critical thing, and the stakes are so high, and if it doesn't work out, like you don't want to, like you're going through the mourning process, so it's like you don't want to talk about it's definitely a roller coaster of like there's very, very high highs and there's very, very low lows. You don't know which one's going to be the high and the low,
right?
So I very much
and even
agree.
if they do, like for IVF, like even if they do an embryo
like transfer
transfer, now you're worrying if it's going to take, right? So it's just like we're not even talking about even just like getting to that part. Now it's like worrying through the pregnancy and all those milestones. So it's like that's why I really think of like, even if it's not a sex therapist, like having a therapist in general to talk through the emotional side of things while you're going through the medical side.
Yeah, I feel like it should be. I in my head think that it's mandatory. I know that it's not. But really all my patients in general, just flat out, men, women, children, whomever it is, like, who are you talking to that isn't family? Who's a counselor, behavioral therapist, like sex therapist, like who else is on our team? Like it comes back to this, like, you do kind of need a team to get through all these things.
And I compare it to like I've worked with clients who are going through like bariatric surgery or gender affirming surgeries, and like part of the case is that they have to work with a therapist. Like they have to get signed off. Even bariatric, they have to get signed off on their relationships when it comes to all like how they use food and all that stuff. But when it comes to fertility, that's not part of the process. So I think it's frustrating on like the medical world. On one hand, sees it like, well, this is beneficial because we know there's going to be a big emotional toll. But when it comes to the fertility part, it's being missed.
Yeah. I mean, we could do a better job on all of that.
Yes.
And I think even diving, into that idea of the medical world, which we probably will do in a few minutes.
Probably.
We'll kind of see how, we're not going to be able to fix it today. That's not our task, but having these conversations and talking about it and letting people know that there's options, know that there's just different avenues to take, different people to talk to. And even if I'm not the correct person that you should be seeing, like if we are having these conversations and I can't get through to here, I need someone to kind of get through to here first. And I know hard and fast that is not my job. And I need to send you to a professional like my friend Dr. Leslie. who can help kind of like get in there.
Yeah, and
so that we
vice
can do
versa,
the real work.
right? You know,
Yes.
I deal with this, but if we're talking about physiological, I need to refer out.
Exactly. And that's why we're friends.
Yay!
Yay.